Intro to Human Sexuality. So, Professor Alexander, this is chapter 13. What's going on? Students, take notes. Hopefully, you have something to write on, or maybe something that you're going to type into some type of text or a laptop. Or you could take notes the old school way. Studies have shown the more you take notes, oftentimes that writing can be beneficial. It goes into from your short term. When you review it often, it goes into your long term. This is chapter 13, the sexual body in health and illness, right? Good thing about seeing this as a recorded file, you can always go back and review it. Main topics are living in our bodies, the quest for physical perfection, alcohol, marijuana, and other drugs, and how they influence sexuality and disability, sexuality and cancer, and other sexual issues. As always, feel free to pause and go back and review. So, living in our bodies is the quest for physical perfection. The definitions of sexual health acknowledge two broad elements: sexuality, or the relationships with a sexual or romantic component, have intrinsic value as part of your health. So, healthy sexual relationships require positive experiences for individuals and their partners. Living in our bodies, the quest for physical perfection continue. Good health requires us to know and understand our bodies to feel comfortable with them. Understanding your bodies, understanding you as a person, it allows for you to feel comfortable and to feel good about yourself. Requires a woman to feel at ease with the sight, feel, and smell of her vulva and to be comfortable with and aware of her breasts, right? For health reasons, lumps, check for breast cancer. Requires a man to accept his body, including genitals, and to be aware of physical sensations such as lower back pain. That's something that I am coming to terms with as a middle aged man, or the feeling of congestion in his bladder. I haven't experienced that yet. Our general health affects our sexual functioning, right? Early checkups, regular checkups with the doctor, right? Gynecologist, right? Checking for testicular cancer, checking for um, uterine and breast cancer, right? By sight, feel, touch, and going in, right? Body image and sexuality, eating disorder, serious and often fatal illnesses that cause disturbances to a person's eating behaviors. In this day and age, we are programmed to think at size 4 or very petite, or some of the swimsuit models is normal. And believe it or not, many folks ascribe to that, and feeling less than perfect can lead to shame and self-doubt. So most people with eating disorders have certain traits: low self-esteem, perfectionism, right? You are trying to have that flat stomach that you may or may have when you were in high school. Now you're middle age and you're looking at these magazines and online posts of Instagram models, and you start to have difficulty dealing with the perception of yourself, and also dealing with emotions, unreasonable demands for self-control, negative perceptions of self in relation to others, and fear of becoming fat. A study found that adolescent body satisfaction predicted adult sexual satisfaction, signifying adolescence as the most significant period for establishing a body image. Alcohol, marijuana, and other drugs and sexuality. Belief that alcohol and sex go together is reinforced by popular culture. Alcohol use and sexual behavior are significant risk behaviors in adolescent development. Combining the two is associated with acquiring STIs. Alcohol use among college students is very common. Drinking is associated with sexual risk, right? You start to lose that fear, right? And some people refer to it as liquid courage, because it gives you the courage to walk up to somebody and introduce yourself, or take it a step further than the situation is even allowing for, right? Disinhibition, right? This means an effect of alcohol activating behaviors that would normally be suppressed, right? You become more aggressive, or you might become more tolerant, right? You make decisions that are not aligned with your morals and your values. Alcohol affects the ability of individuals to become sexually aroused. Men may have difficulty getting or maintaining an erection when you drink too much, and women may not experience vaginal lubrication. Physical sensations are likely to be dulled. So alcohol use has been linked to an increased risk of engaging in risky behaviors, including unprotected sex, associated with exposure to STIs, HIV, unwanted pregnancies, and sexual violence and intimidation. Significant predictor of sexual violence in college. So marijuana users frequently report increased libido, arousal, and orgasm, but contradictory reports exist. So there's a lot of uncertainty around marijuana use in sex, right? So it may be a mind thing that you're thinking that is increased arousal or a heightened sense of orgasm, right? But it may or may not be true. Aphrodisiacs are substances that purport to increase sexual desire or improve sexual function, like oysters, or like certain over-the-counter medical pills like Rhino, Extends, Viagra, Cialis. There's a long list. Most recreational drugs actually have the opposite effects, right? So many other drugs have numerous adverse effects and increased risk of STIs, right? Amyl nitrate, also known as poppers, right? This is something that you sniff, right? LSD and other psychedelic drugs, cocaine, MDMA, also known as ecstasy or Molly, methamphetamines, often referred to as crystal, Christina, crank, or you off that Tina, right? Yohimbe, maca, fenugreek, red ginseng, L-arginine, right? And lotions such as Cestra, right? These all are what's known to be, or what is rumored to be, sexually enhancing drugs. Sexuality and disability. Disability or chronic condition does not inevitably mean the end of a person's sexual life. Common myths persist, including these. Sex means sexual intercourse. No, there could be foreplay. There can be a lot of things that are sensual, right? That don't often means that sex is directly connected to sexual intercourse, right? So among those with disabilities, talking about sex is unnatural. It's seen as unnatural. Sex is for younger people who are able-bodied. These are myths. Sex should be spontaneous. That's a myth. Firm penis and an orgasm are requirements for satisfying sex. So these are common myths that persist. Physical limitation and changing expectations. So many people are subject to sexually limiting conditions. Conditions may be congenital, appearing at birth, such as cerebral palsy or Down syndrome. With spinal cord injuries, the effects of sexual response are generally associated with the degree and location of the injury, right? Depending on your ability or physical ability, you may or may not be able to do more. To establish sexual health, people with disabilities must overcome previous sexual function expectations and realign them with their actual sexual capabilities. So, not looking at the norm, or not looking at things like pornography as your example, right? This is all going to be dependent upon your actual sexual capabilities, right? The loss of sight and hearing can present difficulties in both theoretical and the practical understanding of sexuality. Can often be overcome with education or counseling. Chronic illness can require considerable adjustment. Diabetes, mellitus, may lead to nerve damage or circulatory problems that can cause sexual problems. Cardiovascular disease may lead to a heart attack or stroke, which will affect important aspects of daily living. Chronic lung disease affects aspects of person's breathing and severely limit daily activities, including their sex life. Developmental disabilities. People with developmental disabilities most often have problems with major life activities such as language, mobility, learning, self-help, and independent living. Capabilities vary widely. 3 times greater risk of being sexually abused than non-disabled peers. Sexuality education is extremely important. The sexual rights of people with disabilities. Sexual rights of persons with disabilities should be the same as those for persons without disabilities. So sexual expression, right? The freedom to express yourself, privacy, right, should be honored. Be informed about. They have access to needed services. Okay. choose one's marital status. Okay, this is something that we should be free to do. Whether to have or not have children, it's freedom of choice. Make one's own decision and develop to one's full potential. Sexuality and Cancer. Cancer is a collection of related diseases in which some of the body cells continually divide and spread into surrounding tissues. And we have three terms we're going to talk about: benign tumors, malignant tumors, and metastasis. So benign tumors, slow growing and remain localized. So they may be in certain parts of the body, and they're typically, when they refer to benign, they are discovered early enough to where treatment can happen and they go away. So malignant tumors are cancerous, right? When we talk about metastasis, this is a process by which the disease spreads from one part of the body to another unrelated part, right? So cancer and its treatments can have a devastating effect on a person's sense of self, including their sexuality. Education, support, and compassion are necessary, right? We got to continue to educate to bring about awareness, support from your community, a local hospital, and team of doctors, and compassion is needed from everybody: friends, family, co-workers, your community. So women in cancer. So most of the lumps and bumps are benign conditions, meaning they typically do not become malignant, right? So uterine fibroids or ovarian cysts, fibroid, fibroadenomas of the breast, right? Excluding cancer of the skin, breast cancer is the most common cancer in women. Lesbian and bisexual women get less routine health care, including cancer screening. Postponing such tests can result in later diagnosis of when cancer may be less treatable, right? So breast cancer risk factors are: the most significant risk factor is age, but many other factors present increased risk. Inherited changes in certain genes, such as the BRCA1 and the BRCA2, right? So personal and family history of breast cancer. Is it hereditary? Having dense breasts, right? Menarche before age 12 or menopause after age 55. So not being physically active. So after menopause, being overweight or obese or taking hormones. So personal history of breast cancer or certain non-cancerous breast diseases. Having taken the drug DES, right? Or drinking alcohol, right? So breast cancer detection. This is how you go about it. Early detection is an important part of preventative care. So having regular mammograms, X-ray of the breast, is the best way to find breast cancer early, right? Breast magnetic resonance imaging or MRI. They do a lot of MRIs in sports, but a breast MRI, magnets and radio waves used to take pictures of the breast. So most breast lumps are not cancerous. Many disappear on their own, but most are related to fibrocystic disease, which is a common and generally harmless condition, or of fibroadenoma, also harmless. Okay. Table 1 refers to screening guidelines for early detection of the breast. So take time, take notes, and reflect. On the left-hand side, you'll see the risk categories from clinical breast exam, mammograms in different ages, and women with higher than average risk. And these are the Preventative Health Task Force, American Cancer Society. This is what the research indicates. Take time, take notes, reflect. Breast cancer treatment. Most women undergo some type of surgery to remove the primary tumor. So breast conserving surgery or lump pectiotomy, removal of or only the breast lump and some normal tissue around it. All right. When we talk about a mastectomy, that's removal of all the breast tissue, and this may be combined with other treatments. Following a mastectomy, many plastic surgeons and oncologists suggest breast reconstruction, so the quality of life may not be affected. Some women remain breastless, also called going flat. All right, that's a term for it, right? Kind of like slang. But when we talk about the sexual well-being and adjustment after treatment for breast cancer, the treatment often results in dramatic changes to the patient's self-image and, as a result, sexual function. So there's also worry about physical limitations and frequent physical and vaginal pain associated with intercourse, right? And this varies from woman to woman, but there tends to be Some physical limitations, right? For right after. So female sexual satisfaction or quality of life may not be addressed in the follow-up doctor visits. So being comfortable with one's own sexuality along with a partner can enhance self-esteem and make coping with cancer somewhat easier, right? So cervical cancer, cervical dysplasia, or cervical neoplasia is abnormal growth on the surface of the cervix, right? So considered precancerous and can become cancer and spread. Cervical cancer or invasive cancer of the cervix is the most advanced and dangerous malignancy. So risk factors include having had sexual intercourse before the age of 18, giving birth at a very young age, having had multiple sexual partners, having another illness such as diabetes or HIV, using medications that suppress the immune system, and smoking. Okay, that's why smoking is bad for you in so many different ways. So, most reliable means of early detection of cervical cancer is the pap test, or what we commonly refer to in hospitals when you go in and you get a pap smear, right? When we go in and get a pap smear, usually done during a pelvic exam, right? You should get a pap smear uh, often. So, if abnormal cells are found, the pap test is followed by a colposcopy, right? If an abnormal area is seen on the cervix, a biopsy, surgical removal of the tissue for a diagnosis will be done. So, treatment involves removal of the abnormal area. Rarely does the cervix have to be removed. So, in rare cases, Figure 1 shows a pap test and a pelvic exam. Take time, pause, take notes, and reflect. Ovarian cancer, which typically begins in the fallopian tubes, is more aggressive than others because it is difficult to diagnose in earlier, more treatable stages. Endometrial cancer starts when the inner lining of the uterus begins to grow out of control, right? Hyster- Hysterectomy and surgical removal of the uterus effects on a woman's sexuality can vary. So, men in cancer, men are generally less likely to get regular checkups and seek help at the onset of symptoms, right? It's that macho gene that, I'll be okay kind of thing. Or typically, a lot of men have to be told by a family member or a friend, or if they're lucky enough to have folks that work in the medical field, how early checkups, early detection can often mean the difference between life and death. Men should pay attention to what goes on in their genital and urinary organs, as well as the rest of their bodies. Prostate cancer among American men is the most common form of cancer, excluding skin cancer. It is slowly growing disease, and often there are no symptoms. Right, when symptoms do occur, they may include urine flow issues, difficulty in getting an erection, blood in urine or semen, continuing pain in the lower back, pelvis, hips, or other areas, weakness or numbness in the legs or feet, or loss of bladder control. So, risk factors include aging, a family history of prostate cancer, being African American or Caribbean, of African ancestry, and gene changes, right? Because there's a higher risk or a higher number of African American or Caribbean or anybody in African ancestry have a higher risk of having prostate cancer. So PSA is prostate specific antigen, a blood test, right? Poses dilemmas because levels of PSA can be elevated in men and benign condition called prostatic hyperplasia, right? Also, the PSA test cannot distinguish between aggressive and mild forms of cancer. Because prostate tumors are small and slow growing, many men elect active surveillance rather than treatments, several of which have potentially negative effects, right? So, these are the screening guidelines for early detection of prostate cancer. Take time, take notes, and reflect. Testicular cancer is a chance of a man developing testicular cancer is 1 in about 250, but treatment is very successful. Most cases can be found in the early stage, usually discovered a painless lump or slight enlargement or swelling of the testicle. So treatment options include surgery, radiation, chemotherapy, and chemotherapy with stem cell transplants. Loss of a testicle may be felt as a threat to masculinity and can therefore have an impact on the sexual and overall quality of life for survivors. Remaining testicle usually can make enough testosterone to keep a man healthy and able to reproduce. Breast cancer in men. Breast cancer is about 100 times less common among men than among women. Most breast disorders are benign. Risk factors include aging, family history of breast cancer, heavy alcohol use, inherited gene mutation, and others. So symptoms include a lump or swelling, skin dimpling or puckering, nipple retraction, redness or scaling, and discharge. Diagnosis involves clinical breast examination, mammography, ultrasound, MRI, nipple discharge examination, and biopsy. Treatments include surgery, radiation therapy, and chemotherapy. You could always pause this video and go back and look up any of these terms from clinical breast examination, mammography, ultrasound. You can look all these up. Anal cancer is fairly uncommon, although the numbers have been increasing over the years. So most causes may be due to the prevalence of the HPV infection and goes undiagnosed, untreated for some time. So risk factors include a history, cervical or pre-cervical cancer, having numerous lifetime sexual partners, a history of receptive anal intercourse, under the age of 30, HIV infection, lowered immunity, and smoking. There goes that smoking again, right? Symptoms include rectal bleeding, pain in the anal area, change in the diameter of the feces, abnormal discharge from the anus, and swollen lymph glands in the anal or groin area. So surgery is a treatment, radiation therapy, and chemotherapy have been known to help. So when we talk about other sexual health issues, toxic shock syndrome is rare, life-threatening complication of certain types of bacteria, the most commonly Staphylococcus, right? Staphylococcus aureus, associated with recent surgery, the use of contraceptive sponges, diaphragms, and super absorbent tampons, or having a viral infection. So vulvodynia is a chronic vulval pain, discomfort of or around the vulva with no definable cause for 3 months. So once diagnosed, a variety of treatments are available. Endometriosis, right? A disorder within the endometrium, right? We have PCOS, right? Or polycystic ovarian syndrome is a hormonal problem that is commonly among women of reproductive age. Prostatitis is a painful swelling and inflammation of the prostate gland, right? Treatment typically is antibiotics, anti-inflammatory agents, right? And even alpha blockers. So when we talk about COVID-19 and sexuality, also known as the coronavirus, is an acute respiratory illness caused by a new virus that is having profound effects on how people are living. So if you're over a certain age, you're at a higher risk factor. COVID has claimed thousands and thousands of lives, right? So coronavirus can be spread when in the same airspace as another person. So it is recommended to only have sex with the people close to you. The pandemic largely affected the sex lives of many adults, right? So when we talk about COVID and all of these diseases, from breast cancer to testicular cancer, we also talked about the effects of alcohol, marijuana, and drugs, right? And how that affects sexuality. Talked about disability, cancer, other sexual health issues. This particular chapter had a lot of, it was mainly health risk and things that sometimes can occur that we have no control over, whether, we have a heightened risk factor such as it's hereditary, right? Or um, drugs and smoking came up a bunch of times. So you want to be able to control the things that you can control. That's going to be regular checkups. This is going to be going to the doctor, education and awareness about these. So hopefully you can catch some of these issues if you are blessed enough to live a life without any of these issues. But if you aren't, you want to catch these issues early. Go back and review those notes, right? This has been a vocabulary driven, health driven chapter. So I will see you next time.